This conference will now be recorded.
It's 8:30, we'll stand for the pledge.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Welcome, everybody. It's Tuesday, June 10th, to the Board of Supervisors meeting. Sydney is away today, so I'll take over. We have an agenda in front of us. Any additions or corrections? If none, I'll entertain a motion.
Move to approve the agenda.
Jim has made a motion. Do I have a second?
I'll second.
Second. All in favor?
Aye.
Opposed? Passes. We have the minutes in front of us. Any additions or corrections to the minutes or the claims?
I'll make a motion for the June 3rd meeting and claims.
Mark made a motion.
I second it.
And a second. Any discussion?
Roll call, Todd,
Aye.
Mark,
Aye.
Pam,
Aye.
Jim.
Aye.
County attorney is away today. We'll move on to sheriff report for May.
Good morning, everyone.
Good morning.
Good morning.
So I have May fees for you this morning of $11,168.07.
Do I have a motion to approve the sheriff's report?
I move to approve the sheriff's report for $11,168.07.
Okay, Pam's made a motion. Do I have a second?
Second.
Jim is a second. Any discussion?
Roll call, Pam,
Aye.
Mark.
Aye.
Jim,
Aye.
Todd.
Aye.
And I don't have anything else for you this morning.
Thank you.
Yep, thank you.
Thank you.
Thank you. Department head discussion.
I am going to send out the agenda tomorrow. I will be away at training on Thursday and Friday. So if anyone has anything for next week. let me know.
I've got one item. Vince Murphy called me last night, said he's gonna resign from the Board of Adjustments. So I'll put on, either a special meeting or put it on next week to appoint somebody else.
Will it need to be before next week? Because isn't the Board of Adjustments meeting, their public meeting
On the 18th.
on the 18th? Will that give whoever's, we still have the other candidate, or do you have to have a special meeting?
We have to approve.
Right. But I'm just wondering if we need to post a special meeting to take care of that so that before next Tuesday's meeting, so that that individual,
I think the 18th is a Wednesday, isn't it?
Yeah.
yes,
So if we had it on a Tuesday, we could approve it on a Tuesday.
right. So that would give them all of 24 hours or less to review whatever Amanda's got. What is your thoughts, Amanda?
If you guys could possibly schedule a special meeting, maybe like on Thursday, that would probably work best in my schedule, and then I can get everything to the new individuals, so that way they have a lot of time or more than 24 hours to review the packet that I've got for them, because there's quite a bit of information in there, to kind of catch them up to speed if they've got any questions. If you guys can do it maybe Thursday, that would work best for me, but it just depends on what you guys have. But
We just won't be able to take notes because both Lindsay and I are gone.
So we'd have
you mean, I can do
tomorrow?
Thursday and Friday.
Okay.
So we could do it tomorrow.
We could do it tomorrow. So if we have 24-hour notice, then that would work.
I could probably
We
make it work. Yeah.
Call in, call in.
Oh, yeah,
Yeah, you
Yeah.
could call in.
Put it on. Only take 30 seconds probably.
yeah.
I have contacted our other candidate because Vince had also called me and he said that he would serve, so.
I'm just thinking Sydney's still gonna be gone tomorrow,
Sydney will be gone tomorrow, right?
so.
She could call in or not.
I don't know what her schedule is like.
I'm available in the morning, but I've got an appointment at noon, so.
Again, I'm just talking about running the meeting from calling in, that might be kind of I guess I could call it to order.
It's gonna be so basic that
Right, it's, yeah. Very similar to the other one that we had that was pretty much a call-in.
Do it at 11. That work?
That would be better. for
Yep.
me, if that would work
11
for you
o'clock
guys.
tomorrow?
I can make that work. Yep.
Okay, sounds good.
Thank you.
Thank you.
You bet.
Okay. Any other department head discussion? If none, we'll move down to county engineer update.
Couple of just real quick things. Walnut Avenue got closed yesterday, the bridge south of McIntyre. They started mobilizing some equipment in. The echo out of the bridge is essentially done. They got the guardrail put up last week. We're waiting for, I think the DOT is gonna come up and do a walkthrough today. And then I think the subcontractor is gonna come back through and do some punch list items tomorrow. We're hoping by the end of the week, we've got it fully open again. So that project's pretty much complete. And then, if you've been around the shop area, the survey company's been out surveying for the overlay project around the truck route, so that's getting moving. And then our guys are out doing the shouldering project for the paving project I'm working on getting completed and bid, so. Rock run continues.
Any updates on your motor grader?
No, I haven't heard anything. I know, well, the update I have is I think, well, between the two counties, I think he's got his name on one. I thought we were gonna get another one for Worth County. Well, we'll see, but I think we've got one. I haven't heard anything
For work.
well, or anything for sure yet. I don't think they were gonna probably get them delivered until July anyway, or late June, so. But it sounds like we're gonna get one. So, but the other ones got spoken for really quick. All right, thanks.
Thank you.
Thank you.
Okay, moving on. Lincoln Home Health update.
Hello.
Good morning.
So we had our Board of Health meeting last week. I will actually let Jessica go ahead and give you our public health update.
All right, so I'm just gonna go over a few programs that we've done and then just some things that are going on in the public health world. If you guys have questions, let me know. So CPR, we have offered several friends and family CPR classes here in Mitchell County. They've actually turned out really well. We'll continue to offer those throughout probably more of the winter months for individuals. It's a free class that we get reimbursed from a grant for my time. Just more education on CPR is really good as well too. So we'll continue to push that. Narcan, back in March, we offered 2 classes here in Osage. We've gotten several phone calls. We did a bank in St. Ansgar, a couple banks in St. Ansgar, did that Narcan class with them, and then we continue to get phone calls from community members. So in July 17th, we're gonna offer a class here in Osage at the CRC in the afternoon, and then a class at St. Ansgar at the United Methodist Church in the evening for individuals throughout the community. So I'll be pushing out advertisement. I haven't done any of that yet, but that'll come out in the next couple of weeks for individuals to sign up for those classes. Injury prevention, we did a bicycle rodeo on the 15th of May. It was quite windy that day. We partnered with Osage PD but had a really good turnout. We had over 100 bike helmets to give away to individuals. We gave out 26 bike helmets to kids that did not have any. And there was around 36 kids that came through that day. So pretty good turnout. Kids were able to register their bikes with the Osage PD. We had the Osage Mountain Bike Club there that were tuning up bikes, working on them, which was a huge asset for some of those kiddos. And then Osage PD was going over safety skills and just had a bike rodeo there as well too that kids could go through. So a lot of kids didn't ride their bikes just because it was windy out, but they got to go through and they walked through the obstacle course as well too. So that was fun. Laura and I just recently got certified to be car seat technicians. So we do not have any car seat technicians here in Mitchell County. So we did register. This morning we actually sat down and picked a couple dates for some drive-throughs where we'll have individuals register or call in to make appointments for car seat checks. We are going through a program through the state to get free car seats as well too of all ages. So if there's a family that is in need or has an expired car seat, we're able to give out free car seats that we'll have on hand to those individuals. Something to keep in mind for Sheriff's Office, if they get phone calls, Osage PD, St. Answer, whoever, if they get phone calls, they can send them our way. It's not going to be only during these days, but if someone calls and says, hey, I'm going to be in town tomorrow, can you check my car seat? If we're available, we will check it and go over that as well too. So just something new, a new program here that we will be offering. Babysitters Clinic, we're having a Babysitters Clinic class next week, next Wednesday. That filled up quite fast. We're taking 12 kiddos. I have 24 on the waiting list. So I will be offering 2 more classes probably yet this summer. And then we'll offer it again several times throughout the year. So another one probably over Christmas break or on Saturdays, whatever works best in our schedule as well too. Cancer in Iowa, I did send this invite to you guys. We're partnering with the Iowa Cancer Consortium, University of Iowa, and they are coming to do a program for what cancer looks like here in Mitchell County. So going over incident rates. Mitchell County is the 38th out of the 99 counties has the highest cancer incidence as well too. So the state of Iowa is second in the United States for highest cancer incidence as well too. So just going over different prevention, what we offer for public health, and then what the state offers as well too. So strongly encourage you guys to sign up either Zoom or come face to face. A lot of community members hopefully will show up and have those conversations. I think it looks good too, because we do have a concern. Important for you guys to be behind that and understand that concern as well too. Something to go along with cancer, we are offering free sunscreen at the pools this year, or the St. Answer pool, excuse me. We have a grant that we submitted and got some sunscreen for the pools, and then actually during the county fair as well too. Just have sunscreen stations so people can apply sunscreen, use it. St. Answer is super excited to have that on hand. A lot of family members are excited to have that available too for their kids and themselves. I am partnering with the UCC Church Dixie Lob here in Osage. They are putting up a food pantry, and I am assisting in that process, going over the regulations, but just a food pantry outside, so it'll be dry goods only. I don't know when they're starting to build it right now, but that's going to come to fruition here shortly, and hopefully to see these in other locations once they get theirs established. I know Stacyville would be a good location for one outside their church as well too. A good partnership for us, but I'll give more to come on that once we get further in that project. Did you guys get a copy of this report?
I did. I emailed everybody the board of health.
So I'm not going to go over this, but several bills that have taken effect or maybe will take effect that are on House file and state file. I did put in there, so good probably just to review those of what may come down. Nothing that's going to directly affect us, but just some things that public health is watching for those bills as well too. And at the update, going to go over this briefly. As of last Friday, there are 1,088 cases of measles and 33 jurisdictions. About a week ago, 2 weeks ago, Iowa did have their first case of measles in Iowa. Fortunately, the individual traveled and knew that they were probably going to be exposed to it. They were an unvaccinated individual, responsible, self-isolated due to the awareness of the risk. And there was very little exposures when he came back because he did self-isolate. So that helped the exposure to others. But something we are continuing to give free vaccines. We offer free vaccines for anyone. That's an initiative from the state, regardless of insurance status. We are seeing more and more individuals coming in and getting those vaccines. Lots of conversations with Mennonite Amish communities, especially right now, visiting them frequently and having those conversations and getting them vaccinated as well too. The state had a webinar the other day and said, we've done well, just our push of this, our encouragement has increased vaccine status from individuals who were unvaccinated or not up to date on their vaccines. It's really shown in the last couple of weeks. So that's been a good thing as well too. We are seeing increase over the last recent weeks for pertussis in Iowa. So we did have an outbreak of pertussis, I think, last April. So we're just keeping an eye on that. Currently no cases right now here in Mitchell County, but continuing to educate on the importance of getting their Tdap or DTaP vaccinations to prevent that whooping cough as well too.
Just a question, so the measles thing, so if somebody that individual, when they came back, do they go see their provider and then the provider lets you know, or do they come see, how do you get informed about that, or how do you know that?
Yep, so with this first case, it wasn't here in Mitchell County, but we were made aware of it through the state. They
Okay.
pushed an email out to us, but if that were to happen here in Mitchell County, if they traveled in that area, we would get a phone call and say, keep an eye on this individual. We potentially would go in and do the testing in their homes. Otherwise, they contact the providers and say, hey, I think I have the measles. What route do you want me to take? We don't want them in the clinic exposing individuals. So it could be a simple getting them into a separate room, but we have to shut those rooms down as well too because it's airborne. So there's lots of steps behind it. So if I were to go into a home and test those individuals, I put gear on. I am fully vaccinated, so I'm safe as well too. But I put gear on and go on and test that individual. And then just the recommendations. I think they were exposed to like 3 people, family members. They had to give a prophylaxis to one individual, so an updated MMR vaccine, but neither of that, or those 3 individuals did not get measles.
Okay.
So from that too. So we have been in touch with the hospital. I've had meetings with them and kind of gone over our procedures, their procedures, and what it looks like going forward as well too. What it looked like if we had to do a mass clinic of testing, a mass clinic of vaccines, how the hospital's handling things. We will also handle quarantine. So if there is an individual that's unvaccinated and chooses not to get the prophylaxis, they're in quarantine for 21 days. And we have to follow up with them every single day for those 21 days. So just lots of stuff behind it. So our goal is to eliminate that and go from there.
Okay.
So, yeah.
I think you had mentioned at the meeting, if you don't remember if you've been vaccinated, your recommendation.
Yep. So if you don't have, a lot of people don't have records if they're born, their records aren't in. So recommendation would be to get 1 vaccine now just to be in the clear, get an updated vaccine. So we've had lots of individuals come in and get just that 1 dose because they don't have any records of it.
Good thing to mention that.
Any other questions? Okay. That's all I have. You guys can check out the report for everything else.
All right, so to go over some other things that were in that report I sent you. So our expenses and revenues are looking really well. So the month of May, we had brought in about 120,000 of revenue and our expenses were 112,000. So it looks like at the end of May, our expenses were at 84%, our revenue was at 106%. So I'd say that's sitting pretty good considering at that time the year was at about 91%. So we're sitting well. Some updates on our grant funding. We did receive our contract for our Elder Bridge grant. To remind you what that is the grant that it helps out low-income individuals with aid visits for personal care or homemaker services. So we did receive that new contract. We did get a little bit more than we did last year, so that's good. Usually it goes down, but we were able to get more. So we got about $14,500 to be able to go towards low-income individuals to help them out with aid visits. This year we got about 13,000, so we did raise a little bit. I may have told you this one before, but our state grant that we received to help pay for a lot of the things that Jessa goes out and does the activities for, our state grant did increase up to $37,000. This year it was 35, so that increased a couple $1,000s. So tobacco grant with some of the behavioral alignment changes. So currently, Cerro Gordo County Public Health does oversee our tobacco grant for Mitchell County. They do several other counties. We subcontract with them to help with those activities. So due to this change, they're not able to subcontract anymore. So now Mitchell County, as well as the other counties they were doing, are now going to take over that grant. And so that's a $10,000 grant. So we will now be doing 100% of those activities that are required by that grant. But we will be getting all of those funds and doing those right here in Mitchell County. So,
And a little bit about that. So the Iowa Primary Care Association, who's taking that over, holds that. So we will be taking, we have a call with them today, I believe. We will be subcontracting through them to carry that grant for Mitchell County. So I think there's some additional things that we're going to subcontract through Iowa Primary Care Association to have here as well too. We'll have those discussions today and see what that looks like as well.
yeah. So Cerro Gordo has let them know that we will take that back. And so right now I'm waiting to get that contract reissued and then have that conversation today to see what the next steps are. So as of yesterday, I did not bring this up at the Board of Health meeting yet because we haven't had information on it yet, but we did get an email from the state yesterday that there is going to be an additional $6,000 grant to help cover vaccine education. So it's to support activities to educate farm workers regarding the importance of seasonal influenza vaccine and how to investigate and respond to any avian influenza detection on animals and persons within their jurisdiction. So we do have a call coming up in the future to find out more information about that, but I have sent in the signed contract to move forward with that, and now those funds, that should get us through until next January to help cover those the seasonal flu activities that we do. So
That's great.
some other things I wanted to point out. So as we talked before, we have had to increase our rates starting July 1st. So all of our home health patients are aware. And so it will really affect our, just our full fee patients. And so they have all been aware. And so the lower income that it affects, we do have that Elder Bridge grant and our sliding fee scale that does help them. So that is going to be in effect July 1st. Our new website is up and running. I believe we talked about that kind of last time. I don't know if you guys have had a chance to look at it, but it looks great. It's just a brand new, fresh look, and it's easy to get around. And so Jessa and I are able to do the changes and edits, any kind of revisions. I just added something on there today, a newest release. So it's been kind of fun to play around with and to push out. We're going to add that to all of our publication and everything that we push out. So I have not, so the phone system upgrade, I haven't heard an update on that. I don't know where that's kind of sitting at currently. So I don't have an update for you on that. I've been working with Shannon Paulus to get our agency a credit card reader. So now we can start accepting debit and credit card. We do have a lot of requests for that when people come in for getting their vaccines, foot clinics. We get a lot of it with our home health patients too, that maybe they're their family members want to pay the bill over the phone. So we weren't able to do that before. So I'm working with her. She did bring it over yesterday. Now I just need to work with Ryan to be able to get the Wi-Fi, or hook it up to a Wi-Fi port to be able to start taking those. So as soon as we get that, we'll be able to start accepting cards. So that'll be good. Let's see. What else? So Jess and I were accepted into the LEAD program, the Leading Through Engagement Activity and Discovery Program that was hosted through Iowa HHS. And only 20 public health administrators and public health employees were accepted into this program. So Jess and I were both accepted. And it was a 5-week, 6-session training. It was we learned a lot to be able to bring back to our team. And some of the things we worked on were the angiogram personality assessment, which we have brought back and had our staff take, which has been great. Active listening skills, coaching and mentoring practices, compassionate leadership, conflict resolution, understanding implicit bias and leading to change. It was a great sessions. We were able to network a lot with a lot of other public health employees, which was great all over the state. So it was a fun experience. Worked with Justin Trees. He came over from the Sheriff's Department and did MACE training for, so a couple years ago, he had done it for all of our staff. Now he came over and did it for our newest staff that haven't had it. And now they're able to carry MACE with them. Never had to use it, but it's always great to be prepared if that ever is the case. So that was great that he came over and did that. And so I'm able to call him if I have any other new staff, he's able to come over and do that quick. So as far as home health, currently our census is at about 84. I looked on the board, we have about 5 pending referrals that are being admitted this week. So Sasha, our clinical manager, she has been meeting with the local healthcare agencies, nursing homes. I know she's reached out to the clinics, the pharmacies, the rescue teams and things like that to talk more about our home health services and how we can collaborate. And so that's what she's been doing lately to try to just do some more outreach and speaking out in the community. So, and then general assistance. So I met with Ashley and Megan last week to get some training on general assistance. It was, they did great, a lot of information that they provided us. So, and we were able to, somebody came in on Friday, so we were actually able to observe how that was done and everything and ask any questions from there. So since then, I did have Rachel put it on the agenda to update the general assistance policy due to have our agency information in there because it had their phone number and their agency name. So I just changed that in the policy to get an update today. And then I had created they were using the county social services form. So I did reach out to a couple other counties to kind of see what they use. So I was kind of able, I had Ashley look at it. I kind of took a bunch of stuff out since I talked to you, but we'll see how it works. It's a little lengthier than what they were doing. So we'll kind of, as we learn and do some and learn more and see what information we all need, we'll kind of adjust that as we go. But so I don't know if you guys had a chance to look at the general assistance policy that I sent to you guys. Like I said, I just kind of changed the name and the phone numbers that were in there. And we plan to update, signage, put it on, I need to reach out to our website developer about adding a page so people know who to contact for general assistance. And I'll talk to Ryan about changing information on the website to be able to contact our office. So it's the correct number. Did you guys have any questions on anything that was in that Board of Health report? Okay. I'll stay up here for the general assistance. If you guys have any questions.
Thank you.
Hey Laura,
Yes.
if I could, I just wanted to review my office about what's going on. Currently with the phone system, we recently discovered there's over 25 toll-free numbers that are being paid for by the county.
Okay.
This is news to me. It seems every time we see something that's another side quest off to the side. So I'm gonna have to go through again with everybody to try to track down those numbers, because I have no idea
Okay.
who they're related to. I'm sorry this is taking so long. It seems like 3 steps back for every step forward, but I gotta figure out those toll-free numbers.
Okay, just keep me in the loop, kind of
Absolutely.
what's going on.
Yep, I have Dave running that cable for your credit card machine
Oh,
today, so we'll get that set up there too.
Okay.
That was one other IT related thing.
probably heard your computer.
For new computer, yeah, and I have that sitting in my
Okay.
office there, so.
I mentioned the.
The credit card?
Yeah.
Oh, I emailed them yesterday.
Mhm.
Okay,
So
Thank you.
anyway, that's all being taken care of.
Okay. thank you.
Thank you. Moving forward, item 8, discussion and possible action on general assistance program policy.
So I think it pretty much looks like the prior one, other than the updates that Laura had to make and the updates that she made to a new form. I move to approve the Mitchell County General Assistance Program policy as updated.
I'll second that.
Any other discussion?
Roll call, Jim,
Aye.
Pam,
Aye.
Mark.
Aye.
Todd.
Aye. Thank you, Laura.
I will send you a copy.
Thank you for all your work on updating that into Ashley as
Yes.
well for
Yes, thank you.
Approved treasurer's report for May.
Good morning.
Good morning.
I apologize first thing for department heads, I missed that, but just a heads up, July 10th, our office will be closed. That is District 2 DOT annual training in Mason City. So all the District 2 treasurers go and get updates from the DOT with all of our staff. So just so you know, we'll be closed July 10th.
There's a sign on the door to let
There will be
people
a
know.
sign on the door, there'll be on my treasurer's webpage on Facebook, I'll get it out there and let everybody know.
Perfect.
Try to give them like a week or two ahead just to tell people the plan. It's frustrating when you take time to come and then you find out we're not there. All right, so for the treasurer's report for May, motor vehicle paid to state was $191,651.10. Motor vehicle fees to general basic was $12,408.40. Postage to general basic was $785. Driver's license fees to counties, which is a $7 per issuance, was $1,446, which was meant 207 driver's licenses were issued last month. Of those, 9 of them were from out-of-county individuals that chose to come here for convenience. And then organ donation paid to state was $138.50. New registrations paid to state was $164,955.27. The county retained $2,628.35. So last month, the total collections for motor vehicle and driver's license was $374,102.62. Out of that, we kept $17,357.75. It's increasing about 5,000 from about this time last year, which was the projected with the code change, so that's welcome. Property taxes collected last month was $124,226. Penalties collected on that was $4,276. Special assessments collected was $4,226.70. We did have one individual that came in and paid off their special assessment because they were on the delinquent list and they didn't realize it. So they chose to pay the delinquent amount plus the next 9 payments, which they're paying 9% interest. So once they kind of get that, a lot of them choose to do that. We did not have any tax sale certificates redeemed this month. Tax sale is this Monday. So right now I have about 100 parcels on the list. Hopefully that'll get taken down. I sent, by code, I can send the list. I can request a $5 payment from the banks or anyone that wants a list. I choose not to make them pay. I just voluntarily send to the banks because I have my CD rate request mass email. So I just sent it out to all of them and said, here's a courtesy copy. Feel free to contact any individuals. It's all public record. it's in the state answer paper this week, so if they have somebody that has a mortgage or something, that's how the special assessment was found for the individual. I'd rather collect the money. My job is to collect the money, not to have tax sale certificates. So the more money we can have coming in and have going out to everyone, the better. Prepaid taxes was $3,471.16. Like I said before, that's usually individuals that either have money from their property, from their income taxes and want to take that money and put it towards the taxes that are coming, just to manage their finances, or they've sold a parcel and didn't realize it. Interest on investments for last month was $85,524.36. We did have 2 CDs that matured, so that was about 10,000. So that was a jump from last month. So, and then miscellaneous receipts was $2,520,933.26, and we processed 82 miscellaneous receipts last month. For total revenue in the treasurer's office last month of $3,134,117.85. Any questions?
If none, I would entertain a motion.
Move to approve the treasurer's report.
Jim made a motion. Do I have a second?
I second it.
Second. Okay, roll call.
Roll call, Mark.
Aye.
Pam.
Aye.
Jim.
Aye.
Todd.
Aye.
And then like Laura said, we did set up the credit card machine over there. I have also given her access to my treasurer's accounts. I made her own user so that she can also email out payment requests. So individuals, family members that would like to email and log in and just pay it online can do that too. So I see it going really far for people.
Mhm.
And then she doesn't have to deal with checks from people that are.
That's
wrong
great
things.
service.
Thank you.
It's
I
exciting.
appreciate your help, Shannon.
Oh, yeah, it's fun. It's anything to make it go better, so thank you.
I still haven't got my email.
Thank you. Moving on, approved recorder's report for May. Looks like, the total collected was $26,090.31. Of that, we kept $7,074.56. That may be wrong, I'm sorry. Total amount paid to county treasurer was $7,206.56. I would entertain a motion for the recorder's report.
Make a motion.
Go ahead, Mark.
I'll make a motion with the recorder's report for May.
Mark has made a motion. Do I have a second?
I second it.
Pam, second. Any discussion?
Roll call, Todd.
Aye.
Jim.
Aye.
Pam.
Aye.
Mark.
Passes. Discussion and possible action on contract for services for opioid treatment program.
So that Deb Roth, I think is how you pronounce her last name, so they came and spoke about that clinic that they were opening up, and they were, I guess, checking in to see if you guys were willing to contribute to it. So the amount requested was $13,473.03. And then it would be used for that methadone clinic to help with the rising overdose numbers.
Well, I recall when she came, and I think that was the last time we talked about it, wasn't it? Until it was put on the agenda.
Right.
I'm not sure if is that a yearly amount, or once it starts, it goes down?
My understanding was that it was a one-time setup.
Oh, is that what, okay.
I mean, they may come back and ask in the future too, but that was my understanding.
That's opioid funding then, also, correct?
Correct.
Yes.
It's coming in. And what is it, do you happen to know what the balance is on that opioid fund right now? Trying to think of where we were at.
Lots.
Yeah,
Yeah,
I
Right,
think it's
but-
40 to 50,000, something like that.
Oh, is there that much?
yeah, it was at 70 something and then we,
I might be a little too, I don't know.
no. But I'm thinking it's down because that's maybe where it started. Or that's what I was thinking.
I guess it would be a good use of that money.
Well, I think we have to, realize that on the drug and the opioid side, Prairie Ridge is a very valuable resource over there. So I would move that we do the one-time request for services, contract for services, resolution number 1287-25 to Prairie Ridge for $13,473.03 to be taken out of the opioid funds.
Pam has made a motion. Do I have a second?
I'll second that.
Second. Any other discussion on it?
Roll call, Pam,
Aye.
Todd,
Aye,
Mark.
Aye.
Jim,
Aye.
motion passes. Appoint member to North Isle Regional Housing Authority. So I believe we have a few emails. Ashley, you have been serving on that, is that correct? We have another one from Pam that she would be willing to. I also went and talked with Jenny, MCEDC director, for the reason that several years ago, quite a few years ago, the assistant director also served on that. So, I guess thoughts. I mean, I guess, Ashley, you had sent it, would you like to remain?
I am currently the secretary and treasurer for that board, and that term goes through 9/30 of 2025. I'm willing to continue serving in that capacity as long as I'm able. I would note that those meetings are at 9 o'clock on Tuesdays, so that would be a conflict for Board of Supervisor meetings, and attendance is very crucial at those meetings because it can be difficult to get a quorum sometimes, so.
If you're willing to serve, continue serving the rest of your term, and then even possibly further, if there was a conflict, you said 9:30, is the,
September 30th,
September
yep, is when
30th.
my term ends.
So if you knew there was gonna be a conflict, you could let us know like 30 days in advance and say, well, it's not gonna work for me any longer. And then we would have to find somebody, but
Right.
otherwise,
Yes,
you're good to
currently,
go.
I would say Tracy was appointed as the alternate. So I don't know if you want to appoint an alternate and then, if they want to attend those meetings with me, so they kind of get a gist of what's going on at the meetings, that's great.
Yeah, that's not a bad
If not,
Yeah,
okay, Kayla did
I
say,
would like to see that, so Jenny, maybe you could speak.
So we are actually currently the alternate, so Ashley's like the main member, and then we're the alternate, so, and the assistant, so Tracy Sharper did it previously. I mean, Kayla's willing to also like take that on as well for the future. And I think how it's worked is, Ashley and Tracy kind of work together to see who they know. They just always made sure, there was some representation from Mitchell County. And they do fall on Tuesdays. And attendance is very crucial, like just even hopping on Zoom calls,
Absolutely.
it's just, they really do want, they need that in-person attendance.
It's a good point. I didn't realize that your meetings were on Tuesdays, that, from that standpoint. Yeah, that would make it very difficult for someone from the board to serve.
well, is there, I'm good for just leaving Ashley what she wants to do. alternate is already in place. I don't know if there's anything that needs to be done, or we just have a consensus to leave it as it is, or what's.
You had mentioned that it would be a good idea for the alternate or the new person coming on. Ashley was good enough to mention that it would be good if they attended for the next 3-4 meetings or whatever until September, so that, along with her, so that they could get a better feel for what all it entails. I think that's a good idea.
And I can communicate with Jenny's office and we can kind of make a
Yeah.
plan, even if they want to pop on Zoom. I'm no means do they have to come over in person if I'm going to be there, just so they're aware of what's currently going on with that board. And then I can just communicate to you once that secretary treasurer term ends, kind of where I'm at personally, and if I can continue serving on that board or not.
That'd be great.
So we're all right to hold on making any appointments at this time
Yeah. I think
until September.
I think everything's in place, actually.
Yeah.
And,
So, and we're
As long
the
as-
alternate, so Kayla can start attending those meetings and stuff, and we would still remain the alternate, so let's just say if Ashley gave notice, then we would just step in, I guess, as, until somebody else would be potentially appointed.
Okay,
Sounds good.
consensus, I think we're just move forward. Okay, item 13, discussion and possible action on CLP application for M&J 143 Properties LLC.
All right. All right, so, this application, like Todd said, M&J 143 Properties LLC. The total project cost is $65,000. The total amount requested from our funds is $12,000. Going towards renovation construction of the existing building. So the project is gonna consist of 3 pieces. It's a roof repair and a resurface, a lighting upgrade, inside create, and then the repair of the rear deck. How the project will benefit Mitchell County is the project improves Osage Main Street building that contains a very active retail business, create, and 3 rental apartments. So as far as the scoring, there was enough points, so that they're eligible for the program. And it was approved at our board meeting on June 2nd. So I guess, unless you guys have any questions. These small businesses are just, they're very appreciative of these funds that are available to them. Just wanted to let you guys know that, especially these guys have been very appreciative of all the work, and potentially getting those funds. So I just want to relay that to you guys, that, just funds like this, even though it's a loan, it does carry 0%. It does help these smaller businesses that are maybe more in need of some funding like this. Also, last night at the Osage City Council meeting, they also approved, they have a similar construction loan program, and so they approved $25,000 to help out M&J.
No questions, I would entertain a motion on CLP for M&J 143 Properties.
Move to approve the CLP application for M&J Properties.
I have a motion, do I have a second?
I second it.
Pam, second. Roll call.
Roll call, Mark.
Aye.
Jim.
Aye.
Pam.
Aye.
Todd.
Aye.
Thank you very much.
Approved. Approved contract for library services for Mitchell County.
I updated this, for the fiscal years, and then the, asking is at the 178, 578. They did change a couple percentages, because they were talking about, can't remember her name, the one from Riceville, about making it easier to divide between the 4 libraries. So it used to be 25% divided equally, now it's 27%. And then it dropped from 20% to 18% to be divided according to the hours open to the public.
So was that brought to you by them for the percentages?
Yes.
Okay, at this time, I would entertain a motion.
I'll make that motion.
Mark has made a motion. Do I have a second?
Second.
Second. Any other discussion?
Rachel, you said those percents again, so that was 27, now it used to be what?
It used to be 25,
25, okay,
and the 18 used to be 20.
all right. Thank you.
Roll call, Todd?
Aye.
Pam?
Aye.
Jim?
Aye.
Mark?
Right?
Passes. Thank you. Items of note, meetings attended.
I had an Osage City Council meeting last night. They went through, A to Z Drying is, expanding again as far as, 200 by 80 warehouse that they're gonna be putting up. Possibly 3 to 4 new jobs related to that. So the city is updating the urban renewal plan in order to, do a 80% rebate process for that expansion. As Jenny said, they approved their application for the M&J properties as far as what we just did also. They approved it on their side of it for funding. They approved purchasing some bonds for a project that they have going on. Those bonds were sold or were offered in increments to different entities, basically in Iowa, Minnesota, Missouri, but the Home Trust and CUSB were interested in purchasing some of those notes and are giving, they purchased some of those notes. That's the easiest way to say it. So some of that money is staying within our county, which is great. So that's all I had.
I attended the Board of Health meeting last week. Both Laura and Jessica reported on that. I just want to take a moment to thank them for all the extra training and programs that they're working on, especially with the changes from our Health and Human Services areas and our social services. And so they've taken on additional workload, and I just want them to know how much I appreciate that. And the babysitting clinics and the bicycle rodeo and the car seat training and getting trained for that. That's additional things that, again, more outreach services that we're providing within this county. It's awesome. So thank you.
All right, nothing this week.
I had a fair board meeting. Pretty much the committee list is pretty set in stone now, contracts, bands, everything, everything's booked. You do have to do some grass seeding. They are going to, they've always made a flyer up with thanking the sponsors and dates of the fair, and but it didn't seem to be reaching the public real well. So they're going to contact the Charles City shopper. I think Cresco might have a shopper. and possibly check with the EJ. So those flyers will hit a lot more homes in the area. Because they are doing e-ticket sales this year. I'm just gonna be honest with you, don't ask me how it works. It's-
E-ticket only?
You can purchase them online, just like you do for your school activities and stuff now. We are taking cash yet this year at the
The day of the
gates,
event.
and yes, we just couldn't.
Yeah.
You couldn't just completely do that.
Get a lot of people the last minute.
Yeah. So, the food stands are full and they, I believe they have one more here not too long ago that they may try and squeeze in. So it's going good. And then they'll be starting their summer parades, locals for, and I think they're gonna hand those flyers out then too. So that was it. Manure management plan.
Jenkins Nursery, 440th Street, McIntyre, and Happy Pork Incorporated, 2340 410th Street, Osage.
Okay, thank you, Rachel. Public comment.
No comments?
If not, we'll adjourn at 9:27.